What's up, everybody? Physical therapist, Dr. Ryan Whelton. How to avoid burnout or compassion fatigue. So people that come to my courses, they tell me hey, I'm working like 10 to 12 hours a day. I'm getting paid for 8, but I'm working 10 to 12 because of all the ridiculous, EMRs and all those things, that just take forever or whatever, and all the documentation or whatever, and I say, that's not healthy. If you're working 10 to 12 hours a day, but you're not getting paid for it, then you're not in the right place. I think that a lot of these places kind of take advantage, of the fact that they know you can't get your notes done in 8 hours. They give you like 30 minutes or something to finish all your notes, especially Medicare, and it's just not going to happen, So they know you have to stay later to clock out and all that stuff or whatever. I think that, that's not cool. So, in my clinic, I work for myself, but recently I'm getting ready to hire somebody, so I'm kind of like testing things or whatever, and I filled up my schedule more than usual. So I'm working 8:30 sometimes to 5:30, no break, straight through, 19 patients or whatever every half hour, and no lunch, no nothing. Sometimes I get no show cancels, but sometimes I don't, and those days are really, really long. I'm doing it to myself, but I told my assistant the other day, I can see how doctors get burnt out, I used to schedule a walk in the middle of my day, and eventually I'll get back to that. But like I said, I'm doing some things with my clinic, so I don't, and that kind of grounds me. It gives me my time to ground and think and whatever, get caught up on my notes, get caught up on my, other things going on in life. I got 3 kids after I'm usually at soccer or something like that after I leave work. So I think it's really important, that you find what grounds you, what makes you happy, whether it's, playing the piano, whatever you do. For me, I take walks by myself. I'm an extrovert, but I'm actually kind of an introvert, I need time by myself to kind of listen to my mind and see, kind of how I feel about what's going on in the world or what's going on in my life or what's going on in my clinic or whatever. And I think that's important. And I come in here every morning too, and I stretch, I do yoga to protect my back. I've herniated a disc before, so I stretch and make sure I keep up with that. So, I think it's so important, because otherwise you start snapping at patients. You have no tolerance for things, and I can see how that happens. I love what I do. I love treating. A lot of people get to the point in their career like me, 15 years in, and they don't want to treat anymore or whatever, but I love it. But I'm actually, starting to, kind of think about maybe stopping what I'm doing, just because I can see how that happens. You just get so overwhelmed sometimes. The other night I got home and my wife's like, "Why aren't you talking?" And I'm like, "I feel like I've been through that washer machine, and I just got out and I'm really disoriented because I saw 19 patients just straight out, no break, no shows, no nothing, it was nuts." So anyways, you got to protect yourself. If you're not happy, you're not a good therapist, and it's important to, work on yourself, do yoga, do whatever it is that make you happy, meditate, go for walks like me, have some time alone. All right. Anyways, peace. Have a good one.